the Dementia Researcher podcast, talking careers, research, conference highlights, and so much more.
Welcome to the Dementia Researcher podcast. In this show, we chat with Dr Claire Sexton, Senior Director for Scientific Programs and Outreach at the Alzheimer's Association, to learn more about what we can expect at this year's AAIC. Hello, I'm Adam Smith. I'm the Program Director for Dementia Researcher, and I'm delighted to be your host for this week's show. So for those of you who have been listening for a while, you'll know that Claire and I do this every year. It's a simple format. Essentially, we have a chat about the AAIC and what's going on to give you all an idea of what to expect. Because it's such a massive conference and with so much going on, we don't want you to miss out on some of the great features. So this is what we do every year. But the good thing is every year there's something new and exciting. But that's enough of an introduction. Let's get into it. Hi, Claire. Thanks for joining.
Hi, Adam. Always a pleasure.
So before we go on to talk about the AAIC, why don't you introduce yourself?
I'm Claire. I work at the Alzheimer's Association. This is then going to be I think it's my fifth AAIC on the staff team. Yeah, we're all ramping up. I work on our conferences, also with others on iStart, as well as doing other work for the association as well.
Only your fifth year? It feels like longer.
January 2020, I started with the association, so it was the pandemic year. The switch to virtual was my first AAIC.
So everything's just been plain sailing since then. I mean, if you can cope with the pandemic, you can cope with anything.
Yeah, there's been fewer changes as each year's gone on, which is nice.
Well, let's get on to hearing about this year's event. So thanks again for joining us, Claire. Let's start with the basics, shall we? When and I'm sure most of our audience know, but for those who don't, when and where is this year's event taking place?
So it is in Philadelphia, and the main conference begins on Sunday, July the 28th, and carries on through till 1st of August, which is a Thursday. And then there's also pre-conferences, which start on Thursday afternoon. We've got full day Friday, full day Saturday, so plenty to attend.
So it's a whole week, essentially, isn't it?
Yep.
When do you arrive in Philadelphia?
So I'll get in on the Wednesday.
Oh, same as me.
So
I need a bit of adjustment time because we should add, despite Claire's English accent, you're not actually in the UK, are you?
No, the association's home office is based in Chicago. So it's a short trip for us to Philadelphia this year.
Okay, so and it's online as well.
It's online, and online again is free for iStart members, and iStart membership is free for students and anybody based in a low and middle income country. So you're able to sign up and get both, if you're a student, both iStart membership and the conference registration for free.
Great. And so if you're new to listening to this, or if you just playing catch up, or you're new to dementia research, iStart is brilliant. It's an organization that brings together researchers from all different areas of research to collaborate on various things, and it's, as Claire said, it's free. And if you're going away and Googling that now, it's got two A's in the middle. It's ISTAART, but we'll put a link in the show notes for those that maybe are new to that. Because I don't know about you, Claire, I'm surprised. I go to conferences and events, and then I suddenly say, I work at Dementia Researcher, and then you look at these blank faces and go, what? You've not heard of it. It's this. And I don't know if you find the same with iStart. You just kind of assume, everybody must know about iStart. And then you'll suddenly bump into people who've just never come across it.
Yeah, and I think there's still people who don't know that it's, free for students is something that we, still get surprised about. But we've got over 13,000 members now. So hopefully most people are becoming are aware of it and getting our weekly newsletters.
Wow. And it's not a group of people that stand still either. There's all these, for anybody who's listening, I can't quite work out when this podcast is going to come out. So if you're listening now, either the last 6 shows or the next 6 shows are all podcasts that we recorded with iStart professional interest areas, which are groups of researchers that focus on particular areas of research or careers or different specific topics. And we did 6 podcasts with them talking about their brilliant work and their research field. So have a listen to those as well. And those groups are ones you can get involved in. And they all do you really proud. Those are already recorded, and they all do a really great job of selling iStart as well. So if you want to know, go have a listen. So it's not too. Is it too late? Let's just assume today's the 11th of July. Let's assume this podcast is coming out around the 15th. Is it too late to register to attend in person?
No. So then, well, firstly, if it's coming out on the 15th, congratulations to England in advance for winning. The Euros. Just get that in. So we'll see if that stands the test of time. But it will also, while you're celebrating, you can still sign up to be attending AAIC. Registration remains open. So you're able to join either in person or virtually.
Right. So, and once the event starts, if you didn't find out about this until say Monday, can you still sign up virtually after the event start date?
I think you have to sign up at the event by the start of the event.
Okay, so it's really important. Don't suddenly think, oh, it's fine, I can go to something on Monday and go online and then try to register. You need to register before it starts. And it, as Claire said, free for iStart members who are attending online. And then in person, there's a discount for iStart members, but you can still register to attend in person. And I think you can even turn up and pay on the day, can't you?
Yeah. And the thing is, though, like if you register, the more in advance that you register, then you can get access to, the program. And one thing that we talk about each year is, just putting a bit of prep in before attending a conference, to be looking through the agenda and having an idea of, what are the main things that, you'd want to be doing during your time.
And we actually published a blog on this as well last week. So if you're listening, we do have a blog which was written by a member of the neuroimaging peer called Helena Gellison, who works with the neuroimaging peer, and she wrote a whole blog on about some of the neuroimaging peer's activities, but also as well how she suggests you prepare. So go have a look on our website for that blog, or listen in to our blog's podcast, which has a separate channel. Okay, so we know when it's happening. We know how people can sign up. Let's talk a little bit about that pre-conference then. So pre-conference activities start Thursday. And what's going on Thursday?
So Thursday, we have a workshop led by the NIA on enabling precision medicine for Alzheimer's disease through open science. So they've been doing this for a number of years now. It's a fantastic program. And then that is half day on Thursday afternoon, and then half day on Friday. And then on the Friday, we have a whole suite of workshops. So Dr. Oz Ismail, who's been formerly on a number of these podcasts, has been leading this with iStart, and has really led this to far more workshops than we've been doing previously. So then a lot of these, we want it to be a bit different to the main conference, and they're more hands-on. So, the neuroimaging peer are doing a workshop as well, which is, again, learning hands-on skills for neuroimaging analysis. We have leadership skill development. We have looking at the mini linguistic state examinations for looking at aphasia. So again, these are smaller groups. So then it's, between sometimes, 30, 50 people, with moderators going round, and, just a great way to be enhancing not just your knowledge, but your skills as well.
So while we're talking, I'm scrolling through the web page that's got all these listed out, which The website is aic.als.org for anybody listening who wants to go have a look. And if you go on the pre-conference section there, these are huge. So all these events happen at a hotel. This is at the Marriott Philadelphia downtown, and are they all afternoon on the Friday?
They're all morning or afternoon.
Okay.
Or full day. There's a couple which are full day.
And there's literally everything in here, like tips and tools for being a successful grant submissions. That's all afternoon on Friday. These are you've called these iStart immersive workshops.
Yes, that's right.
Phenotype harmonization consortium. There's computational interspecies translation of omics signatures for AD. Increasing diversity, recruitment and retention. This is brilliant. So, and again, not something that often comes up at conferences like these, that these not even necessarily, I mean, some of these are career related, but just in the area of those involved in research delivery will benefit from these.
Yeah. And as you say, so many different ones. Another one, a couple that you didn't mention then, is there's one on partnering with people impacted by dementia in research. And then another one, which is like on assessing and addressing hearing, vision and olfaction in individuals with cognitive impairment. So then, yeah, if there's anything that catches the eye, these workshops can be just added on during the registration process.
Oh, so if you've already signed up and didn't tick the boxes to attend some of these, can you still go? Yeah,
if there's space. So some are sold out, but yeah, you can go back to your registration and you can add on.
And were they extra? Did they cost more?
Yeah, there's a small cost for them. The cost for these, to be honest, we add these on just so that people show up on the day, because if something's free, a lot of people, register and don't show. But yeah, there's a small cost just for registering.
Brilliant. And I love that these are all happening in the same hotel as well. So you can do two different things. You can do something in the morning, something in the afternoon, and there's lunch. I think there's lunch there, I seem to recall.
There is
brilliant. Do you know what, though? You've just made me worry now that I know I definitely signed up for some of these. I just can't remember which. So I need to go back and check which I signed up for. So that's Thursday's the NIA program. Friday's the immersives workshops, and then we get to Friday, which is more pre-conference. No, Friday is the immersive. Thursday is the workshop. Friday is the immersive. What happens on Saturday?
Saturday then is peer day. So then most of our peers then have sessions, which then you can drop in on and find out more about them. We also have the Alzheimer's Imaging Consortium, which is led by our neuroimaging peer, and a technology and dementia pre-conference as well.
So the Alzheimer's Imaging Consortium is at the actual convention center, and the peer days and tech and dementia sessions are both still at the Marriott. Mm-hmm. And so are all the peers, what do peers do at peer day?
So they all have an hour-long slot, and then they use that in different ways. So then it can be short talks, it can kind of be brainstorming, it can be like a debate. We've had people singing in some of them before. So it's a wide range of activities. But again, it's a bit more small, a bit more intimate, a bit more informal. So if there's an area of research that you're interested in, it's a nice way to kind of ease yourself into the conference and get to know some familiar faces as well, so that you can go. It's a smaller group. You can, hear what other people have got planned, and then, making those connections in a kind of easy way at the start of the conference to kind of continue through the rest of the conference.
Yeah, I love that. I remember being from the peer that I was involved in, that we spent. I love that each peer kind of has the flexibility to use that hour in different ways, which means that you can spend a whole day, even if you're not necessarily. Do you have to be in that peer to go to that peer's peer day?
No, so you have to be an iStart member for peer day, but then once you're in, you can go to any peer. You don't have to be a member of the peer.
So that starts at 8:30. I'm looking at the program, so I'm answering these questions on behalf of Claire. So that starts at 8:30 in the morning, carries on till 5. And if you attended the whole day, you could essentially go to 6 different peer days. They're all about an hour long with little 15-minute breaks in between. So you could do biofluid biomarkers at 8:30, then swap over to atypical AD at 9:45, then go to vascular cognitive disorders, across the sex and gender differences, diversity and disparities, and finish the day in cognition, and not have had the same experience. This won't necessarily be an hour of 4 people on a stage presenting their research, will it?
No, we've always encouraged our peers to kind of mix it up a little bit in terms of the format.
So some of these could be interactive, some might be workshops on different topics. So that's interesting. Or if you don't want to spend the whole day because you want to see some of Philadelphia and that's the only day you've got off, you could just go for an hour and then go enjoy the rest of the day, or just do the morning.
Yep.
How do people sign up for the peer day sessions?
That's again as part of the registration process. Then there's somewhere to tick, so you can check if you have registered, and then if not, add it to your registration. So there's still places available at the moment.
So if you've already registered and you just, for some reason, missed this opportunity, didn't think you were going to be arriving on that time, or registered months ago and can't remember, go back to your registration and have a look and see if you can still sign up to some of these. And of course, you've got your own brilliant new community platform as well, haven't you, where I'm guessing you can go and ask questions about these things.
Yep. So again, that was another initiative led by Oz Ismail on the team, and yeah, there's opportunities there to be reaching out and to be getting in touch with other iStart members who are attending AAIC.
Okay, so we sold the pre-conference on everybody. Lots going on. Let's move on to the big event, which is from Sunday to Thursday. And does it usually starts about Sunday lunchtime? Is that still the...
No, Sunday 8 a.m.
8 a.m. Okay. Is it just me that just usually arrives at lunchtime?
It might be.
So it's 8 a.m. Sunday, early kickoff. So what can we expect from the main conference? Let's think first of all scientifically. Let's talk about the research. What do you think are the highlights for you across those 5 days?
Yeah, so we again, as always, we have a fantastic lineup of plenary speakers. So then this, starts with Eddie Lee talking about neuropathology. Then we have Henny Holstig on centenarians, Timothy Miller on ASOs, Savannah Alady on bilingualism, Clive Ballard on psychosis. We have Tara Spire-Jones speaking. We also have Ricardo Allegri, Risa Sperlin, and Mike Weiner. So we have a great lineup there and diverse topics. And then around those plenaries, we have so many different sessions. So we have over 100 different sessions. This year we have more rooms than ever. So there's a lot, again, on anti-amyloid treatments, but also then other targets as well. So then I think we have about 7 different sessions on tau research, a similar number looking at immunity. We have on vasculature, Lewy body dementia, late, atypical dementia. We have work on modifiable factors, on clinical trials, on behavioral symptoms, on dementia care. And also a lot on basic science as well, so on endolysosomal functioning, omics sessions as well. So everything is there, from basic science through to public health and dementia care. And there's on our website, then there's, if you go to alz.org/AAIC, and then on the scientific program, you can get an at-a-glance agenda, which is probably the best place to start and to have a look and to be circling what session names appeal the most.
I mean, anybody who thinks that the AAIC is just for fundamental science is wrong these days, because it, as you've just very clearly highlighted, there really is something there for absolutely everybody. And it's not just a one-off session either, is it? I think that's one of the things I love about the AAIC is it's not just like, okay, well, there's lots of things on the Tuesday for me, but there's nothing there on Wednesday, or there's nothing on Monday, because those themes, if you're interested in vasculature, there's probably something every day on vasculature across the program. You can spend the entire day the entire week just attending things that are going to be in your field, or if you're really good, you'll mix it up and go and attend lots of other things when you can't find the room that you're looking for, because the conference venue is so vast and complicated, and you just think, oh, I'm going to give up. I'm just going to walk in this room and sit at the back. I guarantee that whatever you'll see in front of you will be fascinating. Is it? I'm sure I can't be the only person who does that.
Yeah, and then so we have like different session types. So then we have like the perspective sessions, which are more kind of, big picture. And they're like a great introduction. So that if you're, new to a particular field of research, then, that's a great place to start. And then we've got the featured research sessions, which then kind of dive into the details a bit more for a topic.
Wow. So vast scientific program. How many presenters and posters have you got this year? I love these stats because it's always a big number. And I've put you on the spot, haven't I? Do you know?
I don't have. It's like over. I think it's over 500 different. No, it's over 750 talks. Yeah, it's over 750 talks on, and then I think it's over 3,500 posters. If I remember right.
Wow. Yeah, you could lose a day just wandering in amongst the posters. And the posters are they themed according to the day?
So then the posters then get grouped depending on, if they're basic science, biomarkers, so you can see them across different days. And then we also have a couple of electronic poster boards, and then we're trialing out a couple of electronic poster board tours this year. So then that's something new. It's just on a couple of the poster breaks in the afternoon, but you can go and then it means, people can see from different topics and, group them together in a different way. So we're trialing that out this year, and then we'll see how that works and potentially be expanding that next year.
And if you're registered to attend in person, you can still also access the online platform as well, can't you?
Yes. Yeah. And so all of the main scientific sessions are streamed live, and you can be sending in questions to them, and then they're available on demand for 30 days after. So even if we see that, so many of the in-person attendees do also log into the platform to be looking at posters, but also then, if there's two sessions at once where, you can't decide, then you can catch up with one afterwards. Or if there's something that you went to and then you want to be referring back to it or checking some details or anything like that, you can do that as well. So it's a great resource.
This isn't a tip for anybody, but I certainly know people who by Wednesday, having been at the conference for days and days, are so tired that they do make use of that platform to spend a morning in their hotel room, still feeling like they're attending the conference because they watch online, but just have a lie in, because the session, they start early in the morning, don't they? I mean, first sessions are at
8 a.m.
8 a.m. and carry on into the evening at
5:45. I think that it finishes. Yeah.
Okay. So a top tip for anybody is pace yourself, and don't feel too bad if you do take half a day to sit somewhere and watch the conference online, and relax and enjoy the sunshine, because I think it's hot in Philadelphia, isn't it?
Yeah, it'll be warm.
It will. You made a good point there that I think I forgot to highlight, which is the pre-conference activities are only in person, aren't they?
Yes.
Okay. So you get all the free. So this is another benefit. If you've not registered for next year, do you know when next year is? Are you allowed to say?
Yeah, well, it's going to be, unveiled at AAIC.
do we not? Do our listeners not get a sneak preview as a benefit of listening? It's been a hot topic. I have to say, I've been asked that question so many times in the last few weeks. Where is next year?
It's going to be in Toronto.
Whoa, brilliant.
Don't tell
In
anyone.
Canada. I won't tell anybody if you're listening to this, but we'll use that that's a reason to listen to this podcast. That'll appear in the social media before. Want to know when next year's AAIC is? Listen to our podcast. And they have to get 26 minutes in before they get to that point. Brilliant. Well, thanks for sharing that. So that's another. If you are listening and you're not attending this year, but you are going to attend next year, it's another great reason to attend is you only get to access those pre-conference things if you attend in person. All right, so we've talked about pre-conference. We've talked about the scientific program, which is epic. Are there any? Do you think there are, having seen the program, being involved in building that, and having a look at the themes, are there already some hot topic themes emerging? I usually go away from an AAIC thinking, ooh, this year was all about, microglia, or there was a lot about sleep this year, or there was a lot about amyloid. Do you get a sense as to what do you think are going to be the hot topics at this year's event?
Again, there's, a variety of things, but then there will be updates on the new treatments. So again, there's a couple of sessions on lecanemab, there's a session on donanemab. They'll always get coverage. There's wider than treatment targets, and then importantly, there's even more advances in terms of blood biomarkers. So especially in terms of in previous years we've seen the promise that they've shown in development and in research settings, and then this year we'll be hearing more about their implementation in real world settings, and then also their application for disease staging. So then recently there was the updated criteria for clinical diagnosis and staging of Alzheimer's, so then there's a session on that. So then I think that will be one of the hot topics as well.
It's brilliant and so exciting to finally see that, because you're right. I think I've been going to the AAIC for 10 years now, and I'm pretty sure I saw Henrik at the first conference I went to, whenever the last time it was in Washington, I think was my first AAIC. And I'm sure I saw Henrik there talking about blood biomarkers, and to finally be going to a conference where we're not talking about the promise of blood biomarkers, but how they're working out in real world settings is so exciting.
Yeah, so then it's still, the potential for real world, how close they are, what that latest data is showing is what we'll be able to be hearing.
Well, during the conference, we're also going to be recording a highlights podcast each day, and Amanda Heselgrave, who's one of the people working on biomarkers at the Biomarker Factory in the UK in the DRI, is going to be hosting the show on Wednesday, I think. So I'm sure she'll bring all the highlights for those that aren't attending and in that show on Wednesday. So do stay tuned as well. We're very much a Alzheimer's Association podcast over the next few weeks, because we've got the peers, the relay podcast, and then we've got the highlights as well that will come to you every day. Okay, so what else? Then during the main conference, there's a whole program of extra workshops. We've talked about the scientific program, but there's other things as well, aren't there, going on the fringes?
Yeah, so then we also have like the ask sessions, which are more informal opportunities for Q&A with award winners, with leadership at the association, with the plenary speakers, and they're more informal, so you can ask about the science, but also you can be asking about career development type topics in those. We have the iStart skills workshops at the lunch times. So then they're, spanning things from writing manuscripts and dissertations, grants, creative science communication, building resilience, peer review for journals and grants, using AI, carving out career paths. So, lots of different topics for that. We have lunches at AAIC, and then there's lunch tables where you can be networking. So you can be networking with different peers at those, as well as other other networks having kind of, again, more informal ways to be meeting up and to be meeting people. And then we have receptions. So we have our welcome reception on the first night. We have an iStart reception on the Monday. And then we also have the after hours party as well on the Tuesday. So, and we also have some of the peers doing networking breakfasts. So you can really
Wait a second. The event starts at 8 o'clock. So what time does a breakfast start?
Oh, quite early.
So if you can get up after dark.
Yeah, so
reception-
before that, so yeah, the aware breakfast starts at 6:45 till 7:30. And then the diversity, that's on the Monday, and then on the Tuesday, it's the diversity and disparities breakfast. So we have those before the after hours rather than the morning after.
Are they things that are just in the program that you can just turn up to? All of those, like the session, like the ask sessions you mentioned, and the breakfasts, and those career workshops that are happening you mentioned there.
So the breakfast we ask that people register for, but everything else you can just show up for. It's first come, first serve for all of the lunchtime sessions, the meetups as well. And for the receptions, then it is then like for after hours. Again, you can add it to your registration.
Yeah, I definitely saw that. I know I ticked the boxes for the receptions, and I didn't though for the breakfasts. Funnily enough, but that's when we edit our podcast, so that's my excuse. Well, that is.
But yeah, as you say, it's important to pace yourself with with all of this if you're attending, because it can be a long conference, long days. So it's not that you have to try and do everything, but you can pick and choose and see what's most relevant to you, and what your aims are for the conference, whether it's to be networking, whether it's to be talking about your own work, whether it's to be learning about a completely different area, whether it's to be making connections for your next job. But just that little bit of time at the start to be, or if it's just to be enjoying the conference as much as possible, to be thinking about what it is that you want to get out of the conference, and then to kind of plan accordingly to that.
And it doesn't take a lot of work. I think you're so right. I think just sitting down with the program, for even if you only have an hour to do this or a couple of hours before you go to, I'd never thought about that until you mentioned there, but actually writing down what your goals are for across the conference, whether that is to go and find out more about another field you're interested in, or to make some connections, or find a job, or get some new skills. Actually knowing in advance what they are, I think, can make a big difference, and spending some time with the program to just be a little bit organized. What other tips have you got for somebody who's, so it's a massive program, you've got a whole week going on. What are your tips for somebody who's attending and wants to get the most out of it?
Yeah, so then I think the first one is, as we've just said, is to be, thinking about what you want to get out of it, plan accordingly, be realistic in those plans. Don't be trying to do everything. Make sure that you'll be, enjoying the week, and then, to be open to be, meeting new people, hearing new ideas, and then just enjoying it as much as possible. AAIC is, it's a lovely community. Everybody is friendly. There's ways to be meeting people. We've got a first timers meet up over lunch on the first day. These smaller events are great ways to be going, to be introducing yourself. So I think that's the main things, really.
We haven't actually launched this yet, but we've also, as part of Dementia Research, we've got a new communities service, which is on website and in your app store, called Dementia Research Communities. And one of the spaces in there is called the Conference Buddy Bench. And the idea here is if you're going to something for the first time and you're a little bit nervous, or you don't know anybody, is you can potentially go into the buddy bench space and say, I'm going to this conference, is anybody else going? So you could arrange to meet, or arrange coffee or have somebody hopefully in advance before you get there who you could share with, and we'll use that buddy bench to kind of create some groups and hopefully arrange some social gatherings and things as well. So do have a look at that. If you go to the Dementia Researcher website and then go to the community section on the end, it'll take you off on there after you register. Wow. There is one last thing while we're still on the program, which of course I've seen on there, but I don't know what it's about. So you're going to tell us now, which is AAIC for All.
Yes. So this is new this year that we're launching AAIC for All. So, I think we've spoken a little bit about, AAIC being inclusive in terms of every aspect of dementia science. Also, like every career stage is there. We have attendees from over 100 different countries. But this year we're trying to be even more inclusive still, because we know that it's not that everybody who's interested in dementia science can, attend 4.5 days, that has that time, has that resources. So what AAIC for All does is then it's more bite-sized, more accessible, it's free, and it's on the final half day of the conference. So on the 1st of August, on the Thursday, and it gives you like key take-homes from the conference. So we have 2 different tracks. So one is for members of the public, and this can include people living with dementia, it can include family members, it can include research participants. And then for that, we've got, we start with a session in the neighbourhood, where then it's highlighting local researchers and also highlighting the breadth of different types of research studies that it's possible to sign up for. And then we have a highlight session where we have a number of world-renowned speakers presenting what their highlights have been over the past week. So what their highlights have been in terms of risk reduction, in terms of health equity, in terms of diagnosis and treatment and dementia care. Then everybody's able to join the plenary session as well afterwards. And then in the clinical track, then we have a session on Alzheimer's Association resources for clinicians. And then again, we have a similar highlights session, but then, the highlights will be slightly different. And then it will be, what is the take home for clinicians? What's the messages for them, and, that they should be passing on to their teams, to their staff, and to patients as well. So for this, then, like if you're attending AAIC, you're extremely, welcome to be attending these sessions. They're in our regular convention center room, so you can turn up and, see that summary and get, refresh yourselves of the take homes and anything that you might have missed. But it's also that people can sign up for free just for that half day. So then that can be either in person in Philadelphia, or it can be online. So we're hoping that this is, a great resource. And then also it might be something that people want to use, with their research participants or with their PPI, groups, that you can say, okay, let's watch this, and then we can discuss it afterwards. This is new. We've got, if we're looking across virtual and in person, we've already got over 1,000 people registered for it, but we'd love to get more people and to be spreading the word, as it is, first year for this.
This is awesome. And great. Over the years, the conference has come kind of increased, and you've done more and more sessions, haven't you? Kind of little highlight ones and little summary shows for the end, but to do a whole segment that's specifically for the public, I think is great, because some people have wanted that for a while, to have more members of the public want to get involved in AAIC, and this is brilliant. So let me just get this right. If you're already attending AAIC, you can just stick around for Thursday and go to these sessions like you would do anything else.
Yep, because there's still the others that, we still have the full number of.
There's still the normal program.
This is 2 of them will be dedicated to AAIC.
Okay. And if you're if you want to attend in person, you can just go to this half day in person for free, or you can attend to go online for free. And if you're a researcher that might like to give your participants or your patients an opportunity to know more about research, you can give them this link, and they could register and attend this to find out more about research.
Yeah. So then if you're already attending AAIC, you don't have to do anything extra to register or anything like that. But if you want to pass it on to research participants, then there's a special website, alts.org/AAIC for all. And then it's a kind of streamlined registration form. So it doesn't ask, all of the questions that we ask in the main conference registration, but we tried to make this, just a bit more easier, a bit more accessible for members of the public.
Wonderful. We'll put a link to that in the show notes as well, so you can just copy that and paste that out and share widely by the sounds of that. I mean, get that out on your social channels, send it to your patients, put it on your notice board, put it in your newsletters, because that sounds like a brilliant opportunity to share some of what's going on at AAIC with people living, with lived experience and people living with dementia. Wonderful. Where this so usually, I think the first time we did this podcast, it was about 20 minutes long, and right now we're at 42 minutes, and that, I think that is not that we've talked too much. It's a reflection of all the extra that you continue to do every year and that you continue to add to enhance this event, which I think justifies the kind of bold claim of this being the biggest conference and the best. I'm going to say that.
Yeah, well, yeah,
I can say that.
You can say that. Yeah, in Amsterdam last year we had over 7,500 people in person, and then another over 3,000 online. So it's big, and we have a great team. We have Dr. Igor Fontana and Dr. Elizabeth Wallace now, working on our conferences, and lots new, always happening.
Brilliant. Okay, Claire. Well, thank you so much for taking time out to join us. Before we finish up, I'm going to give you a chance to add, because you don't only do the AAIC, do you? You've got other events coming up this year and early next year. Are there any of those that you want to get a plug in for while we're here?
Yes, so we have coming up in September, Modernising one of our AAIC advancement series, which is on modernising diagnosis. And this is in Tokyo, Japan, and also online. And then following on from that, we have one on exploring equity in diagnosis, which is a focus on US populations. That's in Chicago in November. And then next year we have a meeting on APOE in Miami in March on St. Patrick's Day. We have AAIC Neuroscience Next. And if you would like to apply to be a Neuroscience Next hub, be on the lookout, join AAIC. The registration will be open, so we would love for submissions for that. And also then next May, we will be in Lima in Peru for our satellite symposium. So it's not that all of these are on our website yet, so you're getting a sneak preview into next year's calendar, but yeah, a lot on, and there'll be abstract submissions open and also travel fellowships available, and virtual offerings for all of those conferences.
Wow, brilliant. We also didn't even talk about the iStart ambassadors. So if you're during the AAIC, if you see somebody in a purple t-shirt, they're usually volunteers who are also dementia research, early career researchers who are there to help guide you around the venue, but also as well are researchers themselves who can have a chat to you about their work. Thank you, Claire. Is there anything we've missed? Is there anything that we've skipped?
I think we covered more than enough. If anyone's still listening, the podcast will be as long as
I think we covered everything. So, Claire, it's been a pleasure, as always, to talk to you. 4th year in the row of doing this, and every time you really do come with something new, a new approach. I'm really excited to be heading to Philadelphia myself in just over 2 weeks' time. So don't forget, anybody listening, it's not too late to register and to attend in person. And even if you can't attend in person, all the scientific sessions that were discussed today and the AAIC for All are available online and for free for iStart members. And so if you're not already an iStart member and you're a student, go sign up for iStart, get your iStart membership, and then go to AAIC where you can get that for free. Or even if you're not an iStart member, it's just a small charge. But it's a brilliant program. I'd like to thank our incredible guest, Dr. Claire Sexton, as ever. Thank you, Claire.
Thank you, Adam.
I'm Adam Smith, and you've been listening to the Dementia Researcher podcast. Don't forget to subscribe. And of course, we'd also take this opportunity to thank Alzheimer's Association, who are one of our incredible funders. So thank you very much, everybody, for taking time, and do leave us a review in the show notes. Thank you.
Thanks. Bye.
The Dementia Researcher podcast was brought to you by University College London with generous funding from the UK National Institute for Health Research, Alzheimer's Research UK, Alzheimer's Society, Alzheimer's Association, and Race Against Dementia. Please subscribe, leave us a review, and register on our website for full access to all our great resources. dementiaresearcher.nihr.ac.uk.